Assessment and diagnosis in the field of sex therapy. This is not an extensive list. Once again, this is kind of taken from Goff and Salko's 2017 presentation. But this is not an extensive list, but it's just some of the ways that you're going to want to assess your clients. Once again, from the systemic orientation, you want to understand your client's complete context. You're not just going to be asked them about what happens in bed, although that is a big part of the discussion, and you're going to want to assess those things. There's so much more that people bring to bed with them. Their past, the relationship, so the day in and day out interactions of their current relationship, their family background and early childhood, that general information. What is school like? Are you stressed out? Is that anxiety preventing you from being able to sexually engage with your partner? Maybe work or your occupation. Medication, as I mentioned before, you want to know if your client is being treated or taking medication for anything that may be disrupting their sexual response cycle, religious values, different things like that, and looking into their sexual history. That's a big thing that sex therapists usually do, is they take a look at the nature and development of the sexual problem, as well as take a in-depth inventory of the client's sexual history, so that they know if there's any abuse in the past, if the client is very sexually experienced or very sexually inexperienced. Different things like that that come up through this kind of assessment. Assessment is really important. And then for diagnosis, the DSM-5 lists these diagnoses as the primary sexual diagnoses that you can give. So there's delayed ejaculation, erectile disorder, female orgasmic disorder, female sexual interest or arousal disorder, genitopelvic pain or penetration disorder, male hypoactive sexual desire disorder, premature ejaculation, substance or medication-induced sexual dysfunction, other specified sexual dysfunctions, and unspecified sexual dysfunction. And then one more thing that I have touched on before, but I just want to really highlight in the importance of assessment, is once again that you really should have your client physically examined, because you would just hate to find out that maybe you are treating a legitimate emotional attachment wound of a client that has to do with her inability to connect with her partner. But you would hate to find out that later on that what's really going on is that maybe she had some kind of physical cancer or disorder that went untreated because you didn't send her to the doctor, and that would be really bad for you and for your client. Or maybe that you didn't send her partner in, and he had maybe a disability or some cancer, so that he maybe prostate cancer, and he couldn't get an erection because of these different things, and you're dealing with the wife as your IP, and there's all this guilt and shame or kind of misplaced attention on the female partner when there's a real medical issue going on with her husband. And so anyway, just because of all of those different things, part of assessment, and a crucial part of assessment, is that you have your client physically examined so that you can know or rule out different biological, physical factors in all of that. And then the last thing that I want to talk about is sexual minorities. So this is something that you want to familiarize yourself with if you're not already familiar with it, because more and more people are coming out, more and more people are getting therapy because of issues in their relationship, and sexual issues that they're having with sexual minorities. So you're going to want to be, just like any other cultural sensitivity, you're going to want to be culturally aware and culturally sensitive to sexual minorities. Lesbian and gay relationships, your your process as a therapist does not change because the sexual orientation of your client is different. So that goes back to, again, this systemic orientation. So don't get caught up in the content of all of that. But with that being said, content is important in that you need to be educated and you need to be aware of the different issues or presenting problems that may come up when you are dealing with sexual minorities. So you may want to be aware of just the different issues that a lesbian couple may bring, or a gay couple may bring, or a transsexual partner may bring to the table. You're going to want to be familiar with these things so that you can ask the right questions, so that you can be curious about the right things, so that you have a general grid of understanding so that you are able to help your client go through whatever issue that it is that they're bringing into therapy with them. So that's why I put on there, once again, not to do a system overhaul. You want to be familiar with the differences between gender, biological sex, gender identity, and orientation, so that you can use sensitive languaging, and so that you can understand those differences when your client comes in and says that they have that they are biologically a female, but they have a gender identity that is different than that, and and you're going to want to understand their orientation and their understanding of the cultural of their culturally placed, the gender that was culturally placed on them since birth, and how they're dealing with that. Then I've listed some other resources for working with LGBT clients, thanks to Dr. Dale Bertram, and that is listed there. So I hope that the presentation today was helpful to you and that you learned some things. You had your appetite whetted for sex therapy. Some of my references are listed here, and I hope this project was helpful for you and that you get some good CEU credits and pursue sex therapy as you're interested in it. May become ASEX certified to become a licensed or a certified sex therapist. Thank you.